What is keeping you up at night right now as a chief nurse?
Probably a few things, one of which being our staff, their well being overall, and the resilience or maybe lack of that exists after 2 really challenging years.
You have to view staff safety the same way you view clinical patient safety. It's important, it's essential, and it should be expected.
In order for organizations to deliver on their patient experience promises, that can only be done on the foundation of a resilient and highly engaged care team.
Healthy work environment was at the top of the list intentionally because anything built on top of an unhealthy work environment is a house of cards.
The board really sets the strategy for the organization and the success indicators that it will use. In the nurse executive, it's a voice that needs to be at the boards.
If a nurse was serving on the water board in Flint, Michigan, perhaps the issue of dirty water, contaminated water would have been dealt with in a very different way.
The key to success is keeping your foot on the gas pedal. We were committed to making this work. And we noticed that if you take your eye off the ball, then people go back to their own habits.
Hearing that reassurance of it's going to be okay, I'm here with you, that meant so much. And I always want to remember to keep doing that for patients. But I owe my life to the medical community that I've been a part of.
The training and education of triage nurses is so critically important because it is a clinical judgment, not a sorting decision. It's emergency nursing in its entirety in a 3-minute time period.
Nursing should be reflective of the people that we care for.
We cannot recruit and hire ourselves out of the workforce challenge. We're going to have to grow our own.
It is hard enough to get to the glass desk for women. And what it represents to me is you've made it to the desk, but the ceiling in a lot of situations still has not been broken.
I am still wearing rose-colored glasses. I am still optimistic, and I think our future is bright.
Celebrating nursing leadership is our episode topic in this special 100th episode edition of the BRG Nurse Executive Podcast. Rejoining us for this episode is Bill Orrell, a registered nurse and managing director at BRG. So let's get started.
Welcome to the BRG Nurse Executive Podcast. BRG is a global consulting firm that helps organizations in disputes and investigations, corporate finance, and performance improvement and advisory. BRG's healthcare performance improvement practice offers multidisciplinary services to healthcare organizations. We focus on implementation with innovative, independent, and data-driven solutions. In the BRG Nurse Executive Podcast, we discuss improving patient care by advancing nursing leadership. For more information about BRG, please visit thinkbrg.com. Now here's your host, Nick Chmielewski.
Bill, welcome back.
Nick, congratulations. 100 episodes, real milestone. 4 years have flown by, 5 seasons. I'm glad to be here for it. I have to say, I've been looking forward to the conversation. Today, I've come prepared with some questions for you.
It sounds like the tables have officially turned, so it's all yours, Bill. Go ahead.
Well, before we get to the episode topic, I want to congratulate you on receiving word that you'll be inducted this fall into the American Academy of Nursing. That is quite an accomplishment, and big congratulations to you.
Thank you. Yeah, I'm really excited and looking forward to the induction and also the Academy's Health Policy Conference this October in DC. A special thank you and a shout out to the sponsors of my application for their mentorship, guidance, and support. So that's Dr. Patty Kuntz-Howard from the University of Kentucky and Dr. Karen Doyle from the University of Maryland Medical System. I also appreciate all the others that have supported me throughout my career to help me reach this milestone, the list of which is way too long to get into, but let's just say it's taken much more than a village to get here.
Shifting gears to our episode topic, let's start with some listenership metrics. How many listeners do we have as we roll into this 100th episode?
As of this recording, so we're actually going to have a little more by the time that this comes out, we have 25,100 listeners across all of our platforms. We're available on all the major ones, so Amazon Music, Apple Podcasts, iHeartRadio, and Spotify. So that number represents the full footprint, which is honestly pretty remarkable when you think about the niche that we're in. This show is built specifically for nurse executives and nursing leaders, and 25,000 people have found their way to it.
It's incredible. I mean, I think back to when this first started, we were doing a webinar and we're struggling to get just a handful of participants. And now to have 25,000 is just great. And I hope it continues to expand. And I think we're touching, like you said, a niche in the market that was underserved.
Agree.
Nick, which episode has had the most engagement?
From an all-time download perspective, the winner is Season 1, Episode 8 that released back in December of 2022. And that's where Dr. Summer Bryant talked about medical surgical nursing. But I do want to give a little context here. That episode has been out for several years, so that's had more time to accumulate more listeners. If we look at listens within the first 90 days of their release, which I think is a more meaningful measure, maximizing CNS values is the standout. Close behind it is our January 2026 episode that was dealing with faculty-guided AI chatbots for nursing education. That one may end up being the most listened episode of all time when it's had a full year to run. Our top 5 all time also include the Nurse Executive Fundamentals of the PACU episode, Moral Courage as a Nurse Leader, and a CNE's perspective on healthy work environments.
I know some people have been a guest more than once on the podcast with 100 episodes now. How many people have been on the show?
Yeah, great question. So across 99 episodes prior to this one, we've had 78 unique guests. Some episodes featured panels, notably our 2 Black History Month specials earlier this year, which each brought in a 5-person panel from the network of Black male nurse leaders. So the total number of individual appearances is higher than that, but 78 different people have sat down with us at some point, and that's a remarkable roster.
So who's been on the most?
Prior to today's episode, we had a tie. Noreen Hudson did a 5-part fundamental series covering the OR, pre-op, pre-admission testing, the PACU, and sterile processing. It's one of our most cohesive instructional arcs in the entire catalog. So she held a tie, a 5-episode tie with one other guest. That's you, Bill. So with the episode today, you are breaking that tie and becoming our all-time guest with 6 episodes.
I will take it.
And then after you and Noreen, Dr. Lisa Wolf from UMass Amherst has 4 episodes, and she holds the record for our non-BRG guests. And then there's a 4-way tie at 3 episodes each. That's Terry Foster, Dr. Jim Ballinghoff, Dr. Anna Valdez, and Lowell Harden.
Well, speaking of external guests, who was our first external guest? And what about our first non-nurse on the podcast?
So our first external guest was Jennifer Schmitz. She was then the CNO at Southern Maine Healthcare and the 2022 president of the Emergency Nurses Association. That was Season 1, Episode 4, which released back in September of 2022. And the topic was emergency nursing in America and its implications for the nurse executive. Jennifer was also our first ENA president to come on the show, and we've had others. As for our first non-nurse, that was BRG's own Peter Chadwick. Peter is a managing director on our financial and transaction side. He's not a clinician, and he joined us in Season 2, Episode 9 on April 28th in 2023 to talk about nursing leadership in a financial crisis. I believe you were on that episode, and that episode opened the door to a whole arc around financial performance, margin management, and what it means for nursing leaders to be fluent in the business side of an organization.
That's interesting. Well, Nick, what's the breakdown of the organizations that our guests represent?
Yeah, I kind of put those into 6 different buckets. First, BRG, our firm, has been represented across roughly 31 episodes with recurring contributors from our clinical transformation, care transitions, peri-op, revenue, advisory, and other performance improvement groups. But beyond BRG, we've had guests from 23 major health systems and hospitals, including the Cleveland Clinic, Northwestern Medicine, the University of Pennsylvania Health System, specifically Penn Presby, University of Colorado Health, UConn Health, UTMB in Galveston, LifeBridge Health, Henry Ford Warren, and many, many others. We've also had strong representation from academic nursing institutions that include Johns Hopkins, Duke, East Carolina, Tulane, UMass Amherst, Sonoma State, Penn School of Nursing, and my own alma mater, Creighton University. And then we've had leaders from professional organizations ranging from ENA, ANL, ANA, the Academy of Emergency Nursing, the Nursing on Boards Coalition, the National Association of Clinical Nurse Specialists, Sigma, DMPs of Color, and the Network of Black Male Nurse Leaders. We've also had voices from the industry and payer side, including Humana Home Solutions, Press Ganey, Mednition, which is the company behind the KAI triage system. And then we've had some independent firms and independent ventures, Advisor RN, NMB Global Leadership, The Glass Desk, Theater of War Productions, and others. It's really been a wide tent.
Yeah, very much. Across the 99 episodes so far, what were the top 4 or 5 themes?
The biggest, by a wide margin, was workforce engagement and leadership development. That accounts for roughly 29 episodes. The topics included span of control, middle manager investment, workforce pipelines, having joy at work, healthy work environments, and succession planning. It is the central preoccupation of this era of nursing leadership. Second was financial performance, quality, and operations. We had about 17 episodes on length of stay, throughput, clinical variation, charge capture, revenue integrity, managed care fundamentals, and performance improvement. Our third kind of major theme was around emergency care, EMS, and acute care operations. There were 16 episodes that dealt with things ranging from triage accuracy to left without being seen, sepsis, ED boarding, hospital-based EMS, and behavioral health crisis. Knowing that I'm an ED nurse by background, I'm actually proud that this was not first. I've tried to make a conscious effort to keep this lower on the list. Our fourth topic was around strategy, governance, and industry trends. We had 13 episodes around nurses on boards, healthcare transactions, home-based care, integrated health solutions, and the industry outlook. And then our fifth was around diversity, equity, inclusion, and belonging. We've had 9 episodes covering structural bias in nursing, men in nursing, the 2 Black History Month panels, DMPs of color, and women in leadership. Honorable mentions just outside the top 5. I talked about this a little bit earlier, but our perioperative service line 5-episode arc, talking about wellness and humor. Workplace violence has been a recurring episode arc. Care transitions and discharge, technology and AI, and then behavioral health.
All right. Well, that is a broad array of topics, but what have we actually learned across the 99 episodes?
5 patterns kind of run through the full body of work, and I think they tell a coherent story. So first, workforce is the central problem of this era. Almost every guest, whether it be a chief nurse, a chief operating officer, an association president, or a consultant, they eventually circled back to the same question. How do you attract, develop, support, and retain a clinical workforce while simultaneously demanding higher safety, quality, and financial performance from it? The solutions that keep surfacing are the same ones: pay-to-learn pipelines, healthy work environment standards, span of control discipline, middle manager investment, virtual nursing, dyad leadership, and then try hybrid care models. So that's the first theme. Our second was that safety of patients and staff safety are now a single conversation, where we used to look at them in 2 different buckets: workplace violence, verbal aggression, incivility, biomechanical injury, ED boarding. Multiple guests have reframed staff safety as a clinical safety metric. You cannot deliver safe care in an unsafe environment. The third is around financial discipline, which is now an integral part of clinical leadership if it ever wasn't before. The modern chief nurse is expected to read a P&L, manage to a margin, and own throughput as fluently as a CFO does. As Peter Chadwick put it, there is a direct relationship between quality of care and profitable operations. The fourth is around diversity, equity, and belonging. Those are operational issues, not optional ones. Every episode we've done on representation, the Black History Month panels, men in nursing, DMPs of color, structural bias, the glass desk, they all treated inclusion as a workforce strategy, a patient safety strategy, and a community trust strategy simultaneously. And then lastly, nursing innovation is converging with AI, the home, and the boardroom. Virtual nursing, AI-assisted triage, hospital at home, home-based care, nurses on boards. The next decade of health improvement really depends on nurses showing up in rooms they historically have not been invited into.
What I'm hearing you describe is a transformation of nursing leadership from a primarily clinical operational role into one that's clinical, financial, and strategic. That is what I've heard this podcast document episode by episode. And from what we've covered, what are the top insights we should take away from this series so far?
3 insights stand out to me. So the first one, length of stay is a team sport, and data is your friend. Across our care transitions arc, Caroline Segovia Marquez, Kamala Corlander, David Broussard, Joe Wall, Ellie Kruk, the recurring lesson is that length of stay, throughput, and discharge are not owned by case management or nursing alone. They require provider variation analytics, unit-level diagnosis, executive sponsorship, and an unrelenting follow-through. Ellie Kruk's line captured it perfectly, that the key to success is keeping your foot on the gas pedal. So many length of stay programs fail to sustain because people take their foot off that pedal. The second insight is that staff safety is patient safety, and we need to treat it that way going forward. Dr. Patty Kuntz-Howard's framing that you have to view staff safety the same way you view clinical patient safety. It's important, essential, and expected. That was echoed by Lisa Wolf, Bill Schuler, Dave Corbin, Rebecca Harris, Matthew Howard, Mike Callahan. Workplace violence and incivility are no longer just HR problems. They are leading indicators of clinical risk and staff turnover. And the good news is there are low and no cost mitigations that work. We did a whole episode on that. And then the third insight, nurses belong wherever decisions about health are made. From Nancy Mannion's line that if a nurse was serving on the water board in Flint, perhaps the issue of dirty water would have been dealt with very differently, to Pam Thompson on board governance, to Lindsay Osteen on the glass ceiling, to Dr. Andrew Aguanobi on home-based care strategy, to Dina Brescher in embedding nurse judgment into AI. The through line is that the profession's next chapter depends on nurses showing up in rooms they haven't been invited to before. And nurse executives have a duty to push more nurses into those rooms.
Are there any other observations worth sharing?
A few jumped out to me when I looked at the full catalog. First, the recurring fundamental series that we did have been quite a success. I mentioned earlier that Noreen's 5-part perioperative arc is the clearest example. It functions as a complete curriculum for any executive that is new in overtaking a responsibility that rolls up to them in that service line. The Care Transition series kind of did the same thing. So we may want to package those more explicitly as kind of like starter kits for new nurse executives. So thinking about how do we do that when it's already out? Is there a way that we can structurally do that? The second is that several guests have come back as their careers have evolved, which gives the catalog a longitudinal quality that I think is unique. Jerry Mansfield returned after stepping into the CNE role at UTMB. Jim Ballienhoff has been back 3 times. Terry Foster 3 times. That where are they now thread is something that is worth leaning into going forward. And then third, and I think this is probably the one that's most striking, is we've hosted an extraordinary concentration of association leadership. Current or former presidents or chairs of ENA, AONL, the Academy of Emergency Nursing, ANA, Nursing on Boards Coalition, and even the Michigan Nurses Association. They've all come through this show. That says something about the trust that this platform has built in the nursing leadership community. And lastly, fourth, reading the episode topics in order, you can see the field itself evolve over the last 4 years in the 100 episodes. Season 1 was all about emerging from the pandemic. Nearly every guest talked about it. Season 2s and 3 kind of shifted a little bit to operational performance pressure. And season 4, we moved into AI, virtual care, and home expansion. And this year has been about integrated health solutions and the transactions landscape. So this podcast has really tracked a real industry arc as well. And that's a story worth telling explicitly.
So where are we in terms of recording episodes for the rest of the year, and what episode topics are going to be covered?
The rest of season 5 has already been recorded. So here's what's lined up. Episode 101, our very next episode, Susan Stacy is going to return from Providence. She's going to talk about building your workplace pipeline as a nurse executive, and that'll air later this month in August. In September, we've got 2 episodes, basically 2 episodes a month for the rest of the year, and that's kind of been, we do 25 episodes a year, so essentially 2 every month. In September, 2 episodes. Erin Kelly from Jefferson Health will talk about branding your nursing unit. She's a nurse manager, and she's really prominent on branding her unit as a recruitment strategy. Episode 103, Jean Vanella from Canopy is going to talk about violence and behavioral health boarding. And then in October, Andy Foley will be back from the Academy of Emergency Nursing. She's going to talk about imposter syndrome for nurse leaders. And Tammy Powers, I guess October is kind of a repeat month for guests. Tammy Powers, later in October, will be back. She's going to talk about, she's from Sutter Roseville Medical Center, and Tammy will be talking about nursing leadership's role in graduate medical education. As we shift to November, Jasmine Thomas from the University of Maryland Medical Center's Midtown campus will talk about the reluctant leader. If you remember, back in, I think it was in June, we had Rebecca Altman and Lowell Hurden on, and they were talking about the wonderful culture and throughput improvement work that occurred in their emergency department and a new manager that they cultivated during that project and how she was a reluctant leader at first. Jasmine Thomas is that reluctant leader. She's going to be coming back and talking about her evolution from a I don't want to do this to now a thriving nurse manager in the organization. Later that month, in November, Paul Sarnese from Secured and Prepared Consulting is going to be talking about protecting the healthcare workforce. In December, Fred Nice from Advisor RN will be back. He's going to talk about disciplined leadership in a book he wrote. And then closing out the year, Rebecca Altman will be back from the University of Maryland Medical Center. She's going to talk about APP reporting structures. And then we'll kick off season 6 in January. Typically, we have you kick off the year, so I'm assuming that's going to happen as well. We'll have another guest to join you for kind of a round table. And then later on in season 6, Jean Vanella will be back. She's going to talk about technology solutions for staff safety. And I got to tell you, we recorded that about a month ago, but there are some things going on from a technology safety perspective that I didn't even know existed in some hospitals. Paul Sarnese will talk a little bit about it in November, learning about what other countries are doing and things that are happening and how it will eventually work its way into the United States. And then Jean next year in season 6 is going to give us some real solutions that are already being used in U.S. hospitals. So it's a strong lineup, a great mix of clinical, operational, strategic, and leadership development topics.
That's a great lineup. So Nick, what are we looking for as we evaluate potential guests for this series? And more importantly, how can someone interested in being a guest reach out to discuss a possible episode?
If you're interested, please just email us. The email address is healthcare@thinkbrg.com. I'll say that one more time, healthcare@thinkbrg.com. Our target audience is nurse executives and those aspiring to those roles. So we target each episode to run about 20 to 30 minutes. That's focused, it's practical, not filled with a lot of extraneous information. Yes, we've had some that have been a little bit longer, but usually we're right around that mark. If you have a topic that fits our audience in that format, we'd love to hear from you. I will say this honestly, because we've had people reach out to us that we don't proceed with recording. We respond more favorably to people who reach out to us directly on their own. If a third-party marketing company reaches out on your behalf, that's kind of a flag for us. The guests that have made the strongest impression on this show are always the ones who come to us themselves with a clear point of view and a specific idea. That's what we're looking for. And you know, when I reach out to people and ask them to, you know, when I solicit them and invite them to come on versus them coming to us, one of the questions I always like to ask is, what are you working on right now that's interesting to you? And hearing that. And then the next question is, okay, if that's what you're working on that's interesting to you, what's the angle there for our potential guests? I think that's what our potential guests really that want to come on this show, if they're reaching out to us, need to think about. This is what I'm working on that's interesting, and this is why it's important to your audience. And then in terms of timing, we are currently recording episodes that will air in March of 2027. If you're interested, reach out now, and that's the window that we're working in.
So Nick, any final thoughts as we wrap up this episode?
That's usually my line. I'll say this: 100 episodes is not something I thought that we would ever reach when we started this. You plan the first one and then the next one, and then you end up one day and you've built something. What I'm most proud of isn't the download count or the milestone number. It's the guests. 78 people have trusted us with their time, with their expertise. And in many cases, their stories about the hardest parts of their work. Nurse leaders from across the country on this show have come here and spoke candidly and generously. That's what our catalog is. It's a gift from the nursing leadership community to itself. And I hope it continues to serve that community for another 100 episodes. And before we go, I want to thank a few individuals who have helped support this podcast series behind the scenes. First, I want to acknowledge you, Bill, as well as Megan Wheeler from our marketing team, who helped us launch this series back in 2022. We would not be where we are today without the groundwork that you and Megan helped establish. I also want to recognize Savannah Zellers-Nolan, whose voice opens every episode and carries through the credits. We have also had an outstanding quality review team reviewing every audio file before its release, helping identify areas where we can improve the sound quality wherever possible. Karen Zerbo led this work from season 1 until her retirement late last year, and Sarah Hilton has done a great job carrying it forward since then. I also want to thank Matthew Casilli and the broader legal team who reviews and clears every episode, and thank you to our marketing and social media teams for promoting each episode, starting with Megan Wheeler in season 1, followed by Caroline Frey, Rob Wilson, and now Deb Volp. It's been a pleasure to host and produce this podcast, and as you can hear, it has truly been a team effort. So thank you, Bill, and thank you to everyone that's listening. You know, Bill, I appreciate you inviting me to do this. A good 4.5 years ago, I know it took us about 6 months to really kind of kick things off, but I was maybe the reluctant leader when we started this, telling me, you want me to take it over? And me kind of saying, no. And well, that's not a request. That's kind of a mandate. And then we reworked it into a format that was going to work. Because I think you and I can both agree the Nurse Executive Forum, which is what we had before this podcast, was not an effective long-term strategy. This is.
Yeah, your podcast production skills have certainly evolved over the past 4 years and are really in a great place. So that's also been interesting to watch and rewarding. But I'll say, Nick, from my perspective, having been part of this since episode 1, what stands out is how much the conversation's evolved. I mean, when we first started, nurse leaders were all still wrestling with COVID and the impact it had on their organizations and their communities and their staff. And now the conversations are more complex and more strategic, more consequential. And the podcast has kept pace with that evolution. And it's all due to you and your ability to find the guests and conduct interviews and your production skills evolving. And again, congratulations to you and everyone that's contributed to the show. And here's to the next 100 episodes.
Thank you, Bill. Thank you for joining us today. And thank you to our guests for their insight and expertise. And thank you to everyone that's listening. We appreciate you spending your time with us on this channel.
You've been listening to the BRG Nurse Executive Podcast, which focuses on improving patient care by advancing nursing leadership. The views and opinions expressed in this podcast are those of the host and podcast guest and do not necessarily reflect the opinions, position, or policy of the guest employer, Berkeley Research Group, or their other respective employees and affiliates.